And we are up. This is episode number 12 of the Our Town podcast, coming to you from Madison, Alabama, the greater Huntsville area. And today's guest is, this is exciting. If you have hopefully watched or had an appreciation for the episodes that I have done so far, this is now kind of a departure from some of the guests that we've had, which is in the sports world, some that have their own programs on the radio and things. But sitting before me today is Dr. Albert E. Rivera, but nicknamed Bo.
Bo, that's right.
Welcome.
Yeah, welcome. Thank you very much.
So we have to start with that.
Yeah.
Certainly my name is Monty, and you'll if you catch episode 11, Tori from WZYP interviewed me in episode 11, and I revealed to her that Monty's my first name, but I go by Troy.
Yeah.
But what's your middle initial? What does that stand for?
Earl.
Earl. Okay.
Yeah, so Albert's my dad's name, and Earl's my granddad on my mom's side.
Okay.
And a lot of people didn't know Bo is what I've gone by since I was tiny. Mm-hmm. So even graduation from high school, who is Albert? They announced Albert, and everybody knew he was Bo. So it's kind of the big reveal was at graduation.
So when did Bo start?
If I have the story right, the last I remember them telling me is as a kid, my dad moved from Texas. My mom's from Alabama. And they were at some fair and getting, I think it was a sailor hat, something embroidered. Mm-hmm. And she wanted to put Albert because that was my name. Mm-hmm. And he wanted to put boy as just a joke. Like, well, in Alabama, you call your friend boy.
Boy, right.
And so he wanted to put boy's joke. She compromised, or he's kind of the deal maker. So he kind of came with a compromise. If let's put Bo, I'll know that it means boy. And it looks like a name. So you're happy, I'm happy, and whatever. And supposedly that's the story of how Bo came out. I've never seen the hat. I don't think they saved it. So maybe I'm totally misremembering that, but that's the story I got at one time when I asked. And that's been years ago. I need to ask him again. It's been a year since I've asked him that.
And you were an infant or you were a toddler when this all went down?
Yeah, I must have been pretty young. I don't remember it. But
sure.
Supposedly they were taking me to a fair.
So is it weird for people if they just know you as Bo? Mm. Now you're a doctor.
Yes.
Right. So, yeah. I mean, people do see Albert,
mm-hmm.
I guess, listed, but are there certain people that just can't bring themselves to call you Albert or understand that you're anything but Bo?
Oh yeah, anybody I grew up with. I mean, anybody from my hometown, it's Bo. Even at work, I go by Bo. Formal paperwork and things like that, it's Albert, but for the most part, it's Bo.
Not do they call you Dr. Bo or just Bo?
Most of them will say Dr. Bo. Yeah, okay. I don't really care either way. You can call me Bo or Albert or Dr. Bo, Dr. Albert, whatever.
Right.
I just answer about anything. But most of them, for some reason, it just seems like I guess it's an easy thing to say. A lot of them just kind of revert to Dr. Bo. That's kind of the go-to for some reason.
Well, Dr. Bo, you've got to translate some of these acronyms. If you can look over at the screen right now, and this is my main guest promotional screen. That's DO is Doctor of Oncology. Is that right?
He's a Doctor of Ostepathic Medicine.
Oh gosh.
So yes, MD and then DO are the two medical degrees, and DO is a Doctor of Osteopathic Medicine.
Okay. And let's see. Let's step back. So thank you for explaining that, because that's a lot of alphabet soup. I mean, for all of us that are somewhat in the federal government contracting, we have the whole military speak and acronyms that we get used to, but this was stretching my brain.
Yeah. I've learned y'all have little letters. I get talking to patients, and they can have a conversation between. We have some staff members that were military.
Yeah.
And it'll be ABC 1 2 3 XY. Oh yeah, I was at P2 6, and they have a whole conversation, and I didn't know what happened.
And all they spoke was an acronym.
Yeah, acronym. Yeah, yeah. We kind of joke about that too in medical. Most people don't put that many letters necessarily like all out there. We joke sometimes that's kind of a sign that you want attention for all your whatever your what you've done or what you want to do. But
it also has to increase your credibility, right, or your legitimacy as a doctor.
Yeah, it is. Those are all legitimate things, but a lot of times you don't introduce yourself and of course rattle off all your titles.
Yeah, I used to joke around with people in my profession where they would put, I would say kind of some senseless or useless things after their name. And I was like, I'm going to start putting like my golf handicap, my GPA, and just have this long trail of things, right? Commas separated.
It makes you look more
to get a rise out of people.
Yeah. And then they got to ask about it.
What does that 3.6 mean? Oh, that's my handicap.
Yeah, of course.
All right, let's go back to Haleyville. That's where you're from.
Yeah.
And for the viewers, in episode 5, I interviewed Thad Forrester, and behind Dr. Bo's right shoulder is JAG 28, and that episode is all about honor to Mark Forster, his brother who was killed in action in Afghanistan. And that's where you know the Forsters. You grew up with them.
Yes, right across the street.
Let's start with that. Let's just start with, you said just across the street.
Yes.
Let's just talk about growing up in Haleyville and
Yeah.
what that was like for you as a kid. Obviously, the Forsters are a part of your life, but
Yeah.
walk us through that. Because, and as you think about what you want to say there, you know, the Our Town podcast is really about celebrating towns, right? And that town feel. And it's always nice when you do come across someone that's from a small town,
Yeah.
grew up that way, and all that affords. And it also, as a preview to things that you and I will talk about later, I want people to get to know more about you. There's times in your profession where you have been interviewed or clips have been used by a news outlet for your, with your professional opinion on something, but those are very short.
Yeah.
So this is an opportunity for people to learn a lot about Dr. Bo. And, and this is a great chance to say, oh, wow, he's actually from Alabama. And how did he get here? So, tell me about growing up in Haleyville.
Yeah, it was growing up. Of course, you don't probably appreciate as much wherever you live until you go away. I love Madison. It's great. And it's got all the things I want. I'm totally happy here. But I appreciate Haleyville more now that I've left. In a small town, it's just everything's slower. Everybody's just genuine, nice. And I see several patients from Haleyville that come up here to see me. It was more simple. You can't just decide to go, well, I want to go to the pick from 12 movies today, or I want to go to whatever, name it around here. You could do it.
Right.
So a lot of times you had to venture fun, find things to do, find friends. That was a big thing, I guess, friends. You find people that you just hang around with, people, really anybody in town, you could go up to their house, walk in their house, doors unlocked, you get a drink out of the refrigerator, just whoever you want to stop by, you just stop by and have fun. And partly I'm sure that's changed everywhere, but small town, I go home and it still feels that way. I mean, I could probably just walk over to Thad's house and go to his parents and walk in and sit down. They'd probably see me on the couch and it wouldn't be a shock.
Right.
Mostly, we didn't have a lot of extracurricular things, a lot of things we could go find. So you just go outside and walk around until you find somebody. And on our street, it was mostly a bunch of guys. It was Thad, the Forsters across the street, house next to them with the Kilpatricks, another house, the Welburns right beside them. So it's a bunch of guys. Thad's older sister and my sister were she was already gone by the time I was really old enough to do so. And my sister were the only girls on the road. So pretty much if we went outside, they were out there. They may not be right there in front of your yard, but you could hear them on the four-wheeler or out in the yard playing. And you just go hang out, go run through the woods. If they weren't around, you just go walk through the woods by yourself. Go climb a tree, go explore, whatever.
Right.
A lot of outdoor stuff. When we got older, like I said, four-wheelers, I didn't have one of those. The first experience with something like that was a three-wheel. I think this is the first. There's two stories. I can't remember which one came first. Everybody else was getting four-wheelers, motorcycles, so I thought I had to have them. My granddad bought me a three-wheeler, and that was when three-wheelers were kind of thing, but there were a lot of stories about people getting hurt and falling off and all that stuff. I remember he pulled it out and said, I got you a three-wheeler. And I can't remember if my parents were there at the time, exactly that time, but pretty much when they heard it, they just nixed it. It was like, nope, no three-wheeler.
Not going to happen.
Yeah, it's too dangerous. And then another time was my dad got me a motorcycle. And it's pretty big. At the time, at least to me, it seemed big. And I think it was bigger on purpose than I should have had, because when I tried to get on it, it was really hard to get on. And then when he tried to take the kickstand off, it was really heavy. So I think they tried to discourage me from doing that. So I wound up getting a scooter. So that was my transportation across town and to friends, and there was a scooter. So I kind of try to keep up with my buddies on four-wheelers and motorcycles with a scooter.
What kind? It's like a 50cc scooter or like less?
It's like a Yamaha Raz or something like that. I can't remember what it was.
It had basically two gears, right? Like you get up to like 15 miles an hour, and then all of a sudden it just kind of hits a smoother.
Yeah, I think maybe I got up to like 30 miles an hour or something like that. But it works. I mean, it got me across town. I would ride hills.
Yeah.
I'd jump with that again. Their house, they had a little hill that was almost straight up. I'd jump that. We had a pond by our house. I wouldn't go in the middle of it, but I'd go on the edge of it where I shouldn't have been probably. Get the muffler a little underwater and drive out of there. So it's fun. So
tell me about the sports you played.
When I was really little, I did some t-ball. My parents weren't really into sports too much, so they didn't necessarily push me to do it. If I wanted to, they'd let me do it. Did a little t-ball. I I was okay. I didn't really, I guess, wasn't passionate about it. Let's see what else I do. I did a little 1 year of Pee Wee football, and same thing. I liked that, but for some reason it just didn't stick, so I didn't do a lot.
What position did you play that year?
Oh man, what year was it? I think I remember doing some running back and some receiver.
Okay.
That's the only thing I remember completely. Did that. I mostly did, for a few years there, I kind of got out of sports and did music, did piano and saxophone. Got back into sports when I started kind of realizing hanging out with friends as a kind of early teen, doing some playing around. I wasn't in formal sports with a school, played backyard football and basketball and stuff like that. And I was like, yeah, I'm a little quick-ish, it seemed like. I was like, it's kind of fun. So I started talking with some friends that were playing football. I said, okay, I'll try that. I'm, 100 and nothing pounds, but I said, I'll try it. And then thinking about it, I was like, well, I've got to be fast to play because I don't want to get hit by these big guys.
Yeah.
So I started running, and then that's kind of the same thing with that. I was like, well, okay, I'm not bad. I'm not the slowest guy out there. So I started doing track so I could get faster for football, and really enjoyed track and football both. But it wasn't the star, it's a good hobby and enjoyed it. Didn't know enough, looking back, I didn't know enough. I didn't understand the game. I liked playing backyard because I just played it. But now it's really fun to understand football and track too. But there's a lot more
the strategy.
Understand the game, the strategy. Yeah. And I just didn't know that. I was kind of trying to wing it. Now I'm looking like, oh, okay, that's why I didn't play much because I was not big, and two, I was like, I didn't get it. And they tried to tell me that, but you're young, you don't really understand that. I was like, well, just let me go with it. But it doesn't work that way.
Yeah. Yeah, I remember, and the game has progressed so much more so than when we were in high school. It was just a run game.
Yeah.
You didn't see them running the spread. You didn't have 5 receivers. There was we always huddled up.
Yeah.
Now it's like it's no huddle. It's all looking to the sideline for the codes, if you will.
Yeah.
That change every game. It's kind of like baseball in that, right? Where you look down at the third base coach.
Yeah.
He's doing all these different signs, and only one of them is the one that's is a key. Everything else is a decoy. But you got to, what is it again when he touches the belt?
Yeah.
I forgot.
Yeah, we did the wing tee when I was in.
Did you wing tee? Yeah. I have all the respect in the world now for NFL, college, even high school.
Yeah.
At the complexity of an offensive or defensive system.
Yeah. Yeah.
So in track, were you a sprinter?
I was a sprinter. Well, I kind of started off. Originally, when I started in high school, I did 800 and 400.
Okay.
That's just kind of where they threw me in because of my build and everything else. Then I seemed to be leaning towards the shorter events. So I started kind of gradually getting down 400, 200, and 200, 100. Kind of went up being a mix of 100, 400 kind of guy, indoors 60s.
Mm-hmm.
Got better as I got older in my upper years, senior year and all that. I was young for my class. I was kind of the last ones to turn my birthday, to have my birthday. So I was kind of late bloomer, and I started feeling even after graduation, I was getting stronger. And I could have gone to some small schools and run. I was quick enough to do that, but nowhere near the level of, when we went to Auburn.
Right.
Auburn, SEC schools, or just any of the major schools. So thankfully, I kept training, kept running a little bit, early college and summer after high school, and kind of missed it, and went by and talked to the coach, who at that time was Harvey Glantz at Auburn.
Mm-hmm.
I had, thankfully, I'd been lucky enough to get an academic scholarship at Auburn, so it wasn't really about getting any money or helping with school.
Right.
And taught him what I did and kind of gave him my pitch, and he was willing to let me give a shot.
Try to walk on the team.
Yeah, walk on the track team, and made it. And thankfully, he put up with me for a couple of years. Harvey went up, taking another job later, and then Coach Ralph Spry, was there for the last half of my career at Auburn.
Now, when you said you made it, was it the 400 and 800?
I know it was shorter distance.
Okay.
Yeah, the short stuff. But I was surrounded by just amazing, just elite athletes. I was not in that class. One guy came in from, if I can remember all the details, he came from California. I think he'd set the either U.S. record or the fastest time in the world that year, or something just, that's unheard of.
Right.
You don't do that in Haleyville. Well, you can actually. We've had some good athletes come through Haleyville.
Yeah.
One that just won the national championship last year. But none that I had been around like that. So it was just amazing to have those people standing beside me, and gave me goals. I mean, it pushed me because I knew I wanted to be like them, but I said, if I'm gonna do that, I've got to really push it.
Yeah.
And then for me, I knew that my goal was not to win the SEC or to beat, let's even beat them. But the days that they were slacking or that I could tell that they weren't really pushing it, I'd be there. And if I came up and beat them or at least even came close to them, coach and them, they would say, hey, I better pick it up. I don't want this bow guy to show off for me.
Yeah.
So I kind of kept my level up. I'd like to think I helped, made a difference, maybe just to kind of push them. But it was fun. It was a fun. I miss it still. I mean, obviously, probably talking, you can probably tell. I miss it. Coach Spry is actually they're at the national championships right now in Oregon, and he's coaching his last meet. So I was there when he came in, and then now he's retiring 25 years later.
That's awesome.
Yeah.
All right, let's pause the athletics.
Okay.
Let's go back to Haleyville and growing up. And you had said you got into Auburn on academic scholarship.
Mm-hmm.
When did you know you wanted to pursue the medical field, that you wanted to be a doctor?
Okay.
How soon in your life did that seed plant?
Yeah, this is one of those. It's not. Some people have these great stories. I don't. You're not gonna get that from me. It's not a great story. I wasn't a little kid wanting to be a doctor. I don't even remember what I said as a kid. Going to Auburn, I thought I wanted to do architecture. I'd taken a lot of drafting classes, had a good teacher in Haleyville, Jimmy McCrary.
Mm-hmm.
Really enjoyed it. Went to architecture, thought this is it. I'm great. When I got in it, I didn't really fit. I liked the drafting, the real exact part of that, but I was not artsy. Most of the people in architecture, and there's kind of an inside joke with architects I've been dealing with recently that the word artsy, I guess, but I wasn't that style of brain. It just didn't work for me. So thankfully I found that out pretty quick. I was just like, I enjoy it, but you're pushing an angle that I don't like. So I got out of that. The counselors thought that the closest thing to that was engineering. So I spent a quarter in engineering. I didn't know what that was. My uncle was an engineer, my mom's brother. Mm-hmm. But I just didn't know what engineer was.
This was at Auburn?
At Auburn, yeah.
Okay.
Auburn.
All
so
right.
you had to start off in architecture,
right.
in for a quarter or two, and then swept over to engineering.
Okay.
So I did that for a quarter.
What kind of engineering?
It was just base intro to engineering type stuff. And I didn't give it a chance. Now that I've met some engineers around here, talking to them, I think I could have found several I don't know what you want to call it, subspecialties of engineering that I would have loved. Because I think that way, kind of organized. Mm-hmm. But I spent a quarter in it only. I did some Fortran. People that are engineers, they kind of like, oh yeah, that's the old stuff. I did that. I just swapped out because I didn't know what engineering was. My roommate at the time, he was from Haleyville. We'd roomed together. He was in science and math, and I decided to go in that just because I like science, I like math. I was like, oh yeah, that sounds fun. Right. I think, I'm not really sure. I think he may have even been pre-med, but several of our friends, when we talked to him that were in that major, we're all kind of shoot for med school. So I was kind of doing a couple classes, and I was like, well, what am I going to do with this? And I was like, well, medicine sounds fun. I could do something that sounds sciencey. And so it's kind of not an exciting story.
Yeah.
But the closer I got to it, the more I started researching and figuring out what it was, and did some shadowing in Haleyville and in Auburn, different places. Then I figured out, at least not necessarily the specialty, but I figured out that was kind of what I wanted to go after.
Did you ever have an experience, I don't know, going to the doctor when you're growing up, or going to the hospital for whatever reason, and maybe as you think back, like, I kind of actually was really admiring, what they did, or I had a lot of interest in all the equipment, or, the process by which a doctor goes through trying to, come to a diagnosis?
Maybe not. I wouldn't say like a major one. I do remember though that my doctor visits, I don't know if that's because I was terrified or what it was, but I do remember going to the lab and thinking it was interesting. They do the blood draws. It didn't bother me. I'd watch them do the blood draws. I always liked my doctors growing up. I don't know if it was really one thing. I guess I do remember, and I don't remember the timing of it. I know I mentioned it I'm pretty sure during my med school interviews. My granddad had been in the hospital for, I think it was either a tumor that was cancerous or they thought was cancerous or something like that. Mm-hmm. And I do remember thinking I wanted to help in general or help him, I guess. And kind of it was just really interesting.
Yeah.
And that might have been one thing that kind of pushed me a little bit too. I just don't remember the timing of where they exactly hit.
Trying to be someone to help alleviate the pain or find out the cause and the cure.
Yeah, and probably just the curiosity thing of it, just the interesting thing about the why of a lot of things. There's probably a little bit of it, but I don't know if I can say when.
Sure.
That was a major event.
Well, here's a different question. Because I think about my own life where I'm one of those that didn't really grow up with a lot of confidence in myself. I love sports, and I was just kind of in the moment. I lived in the moment and figured that one day I'll have to figure out life.
Yeah.
But I certainly didn't have a family structure or where they were. I had someone was helping me. Hey, you need to start thinking about this and do this when you're 16 or 17 or 18. And so I probably lacked a lot of confidence, thinking I wasn't smart enough ever to be a doctor or a lawyer or whatever.
Yeah.
But do you feel like you had a level of confidence in yourself that you're like, you know what, at some point it'll stick. I know what it is, and I feel confident, and I'm smart enough that no matter which path I'll go, I'll be fine. Versus, I'll never be a doctor because I'm never going to be that good.
Yeah.
Does that make sense?
Yeah. I guess sometimes maybe it's, I don't know, ignorance is bliss or however you want to say it. I guess I didn't know what I was going up against. And thankfully, everybody around me, family, friends, I had a supportive environment. So it wasn't ever, you didn't ever really hear that you couldn't do it or don't do it. It's just like, well, okay, if you want to do it, do it.
Yeah.
So that,
Yeah.
I guess I probably assumed, I was like, well, okay, nobody's saying it's not possible or nobody's giving me too many roadblocks. So I guess I can do it. So it wasn't, it's probably support, even though it was not, say, I guess, direct. It was kind of just assumed that it was just positive attitude, I guess.
Yeah. So then so now you're into Auburn. And so I guess talk to me about when you kind of start putting the plan together for, okay, I'm going to graduate and then I'm going to pursue getting a, medical degree.
Yeah.
And I guess related to that, did you at that time know you wanted to go the dermatology route?
Okay, so that one does have a story to that one.
Okay.
So probably third, fourth year maybe at Auburn, I was applying and trying to get med schools, and I thought, well, I'm assuming I'm going to make it. Whether I do or not, I was going to keep pushing until I did. Doing sports, I thought, well, and I saw the team doctors some, so I thought, well, sports medicine, orthopedics, one of those two areas would be really fun. And thought that was going to be kind of the way I was going to go. I thought, well, I can be a university, team physician.
Yeah.
So I got in school. I went to Kansas City for my med school, and this kind of pulling back a story for Haleyville type thing. Got into med school, walked in med school, and of all people, Joseph Forster, Thad's older brother, who's several years older than me, had gone on a mission, gone to LSU. I mean, totally separate paths. We'd kind of, I didn't necessarily keep up with him. Walk in, and we're both first-year med students in the same class in Kansas City. So no, it's just total random.
And what school is this?
It used to be called University of Health Sciences
Okay.
when I was there, but now it's just Kansas City University. They
Okay.
kind of made it a little easier to remember.
Okay.
So got in. Somewhere along the way, I'm not sure exactly why, but I kind of dropped the idea of the sports medicine orthopedics. I think I remember somebody talking about it, saying that to actually be a team physician was really hard. There's only so many openings out there, only so many universities.
Yeah.
They said, yeah, you can do some sports med, do some rehab, stuff like that, but to actually be the physician, they said, well, yes. And I'm surprised that I would let that bother me, because like I said, I don't usually, it's like, okay, that's good. That's your
Thank
opinion.
you for your opinion.
Yeah, thank you for your opinion, and then just move
Right.
on. But it must have been something else too. But I'd say I was like, maybe I saw some other surgical specialties, and I wasn't really aware of what all was out there. And thought I was going to go plastics. That was kind of my route that I thought, because I was real visual. I like seeing my results. I didn't like giving medicine, checking a lab, not seeing the results. They're healthier and we helped them, but I liked seeing the results. I like them come in, do my job, you walk out and you look. I can tell. I can visually say that it's been fixed. Started down that route. Started a surgical internship after med school at Kentucky. A lot of stuff going on back up. My grandparents weren't doing well, and the stress. It's pretty stressful. surgical internship was
Yeah.
hard, which it is for everybody.
Sure.
But that kind of compounded it. And then I was also at the time kind of doubting if I really wanted to do that.
Hard in the sense of the what you're trying to learn in a very short amount of time, the hours you're spending on rotation or whatever in an ER.
Just
or whatever?
everything. Yeah, it's
Okay.
everything. And the year that I started, they'd actually implemented at least some work hour limitations, which they limited you to 80-hour work week.
Okay.
Which the people prior to us said, oh, these softies, they get 80-hour work
Yeah.
week. So it was doable. It's just that it ramped it up from med school to surgical. It was a big ramp up.
Is that 80 hours over 5 days, 16 hours a day, 5 days, or is it 7 days a week? And
I think it was calculated over 7 days. I think.
okay,
I'm not 100% sure about that.
all right,
And then you had to have no more than 48 hours straight through. If you had that, you had to have like a 12-hour break. I think it was. There was a certain rules
Sure.
to it. So physically hard, emotional. And I'm not necessarily I'm a pretty independent person, but I wasn't married, wasn't dating, away from family. So I was kind of on my own little island. So that probably, did I need support? Maybe, maybe not. I don't know, but just wasn't happy. Whatever it was, I wasn't happy. So didn't put in the work. I didn't love it, so I didn't chase it as much. I was kind of half the time thinking, what can I do besides this? And that's not good. If you're in something stressful, you got to be committed to it. You can't half do it. And that's
Right.
with medicine or whatever else, you can't just hope you're going to walk your way through it.
yeah,
One of the stories I tell people is it was really just a significant event that happened. I was not same thing. I was peak of my unhappiness. I wouldn't say depressed at all. I was not depressed, but I just wasn't happy. I was doing notes about probably 10 o'clock at night in the hospital. Surgeons were going on rounding on their patients. We were sitting at a table. There's about 4 of us, 4 physicians. None of us were talking. We just wanted to do our notes and move on. One of the physicians looked up from our little group, and we didn't know each other. And it's like he just started talking to the air, talking to God or sky or whatever. He said, I haven't seen my wife in 2 weeks. He said, I haven't seen any of my kids' soccer games. Haven't been on a date with my wife in last time I can remember. The times I have gone home, we go to bed immediately and I'm gone before she wakes up. He said, I haven't really had much of a life the last 6 months or whatever amount it was. Nobody's just saying anything. The 3 of us sitting there, he's just talking. And he said, but, well, I guess it's worth it. And he looked back down and started writing. Nobody said a word. For me, if I was passionate about it and loved it, you could say maybe that's worth going after. To me, that was my sign. I said, I'm not happy.
yeah,
If I keep going this route, that's going to be me. And I'm going to have to convince myself that I'm happy. And I said, nope. It's hard to change paths. At least in my mind, it was change paths in medicine, especially surgery. Surgery is kind of you got to be tough. You don't want to quit. You don't want to, but if that's going to be your career, you can't make yourself do it to make somebody else happy.
yeah,
And I realized it, and I was like, you know what? I don't care if they view me as a quitter or whatever. That's okay, because I'm gonna find what I enjoy, what I'm happy about. So wound up, there's little stuff in between there after I kind of got through the surgical year. Finished it up and everything. And during that time, I'd found dermatology, which for some reason I just never really looked at. But a lot of things that plastics had, the visual graphication, the reconstructions, things like that. Cancers, there was some overlap in cancers. Dermatology did a lot of that, but without the hospital. And it was partly the hospital feel. I just didn't like it.
yeah,
And the surgeries, I love plastics work, but I liked the shorter surgeries. So once I found that was a fit. I was like, this is it. Okay, great. Here I'm getting the stuff I like without stuff I don't like.
yeah,
And very fortunate that I got into dermatology program and then just took it. Then it was easy. Then it wasn't the whole in the surgery. I kept thinking, well, everybody probably feels this way. You have to convince yourself that you're enjoying this and it's just life of medicine and whatever.
yeah,
But when I found it, I was like, okay, I get it. Even if the surgeons over there, if I wasn't like them, hopefully they enjoyed it and they have this feeling that I have in dermatology.
I have a friend who's a dermatologist out in Fresno.
Okay.
And I remember him explaining to me, this is like when we were 21.
Yeah.
He was explaining to me why he wanted to be a dermatologist. And he was going through all the other specialties or being in internal medicine. He's like, if you think about it, there's never an emergency, according to him. Now, this is when he was 21.
Yeah.
There's never an emergency in dermatology. That, like there's other emergencies, you break your leg or or your tooth is broken or something.
Yeah.
Like with dermatology, in his opinion, he could, maybe there was something with some painkiller, but otherwise it was always, well, come see me in the morning.
Yeah.
He's like, and I'm only going to work 4 days a week. I'm never going to work on Friday.
Yeah.
And he was like, that's why I want to be a dermatologist.
Yeah.
And he did it.
Yeah.
But I don't know if he still holds on to that, if there's another route, but he was convinced. He's like, there's never going to be an emergency.
Yeah.
I'm never going to be woken up at 2 a.m. for like a skin rash or something.
Yeah. And there's actually kind of stand up for my specialty. We got to kind of support specialty there. And I know you're not. It's a blanket statement. That's what he's saying. But if you're academic medicine in a university, then you'll probably see some of the emergencies, and they're actually stuff that can happen. Most time in the real world in private practice, that emergency they don't know their skin emergency, so they don't even call the derm. They go to the ER, and they kind of get taken care of and go to the hospital route and all that kind of stuff. But
got it.
But yes, I don't. If you're not taking emergency or academic call or stuff like that, then it's nice not to have. There aren't as many emergencies. Even the emergencies aren't that often. So.
Well, like you were saying before, there's a lot of there's if you're not going to be, you got to be happy, to the extent possible, because no matter what you get paid, you still have to go to work every day.
Yeah.
And it might seem like those things like, oh, okay, well, I can make some good money as a doctor, but if you're not committed to it, well, you still have to go to work every single day, and there's going to be some tough days, right? Some really tough days. Mm-hmm. There's going to be tough weeks and tough months, you string together. So it's like any other career choice.
Yeah.
Try to go into something where there's some fulfillment, right, and there's some growth.
Yeah. And today was a fairly tough day for what we have. It's harder than it should have been. And I tell patients this fairly often. It's that if they're having a longer surgery, it's not going like we think. It's taking longer, harder case to get closed or to get the cancer out.
Right.
I tell them it may not make them feel any better necessarily, but I said, we're going to get you cleared. I said, I'm enjoying being here. I'm glad I'm here doing this.
Yeah.
It's not a chore for me to take care of this. And I said, even though it's going longer and we're both getting tired, I said, I've got the easy part.
Yeah.
I said, I enjoy this and I'm taking care of it. I said, you've got the hard part. You're the one, sitting there in the chair. So I'm glad to be doing it. Even the bad days, or a good day, or a bad day in dermatology is better than a good day in a lot of things.
So was it a tough day with just the volume of patients you had, or just a couple difficult surgical procedures?
It was the cases. We have a scheduling system, and the cases should, if it goes to plan, be averaged out where there's a few hard, a few medium, a few easy. It kind of all averages out pretty well, and you can't expect you're going to have a little stair step.
Right.
But you can't predict cancer. You can try, and there's little hints of if it's going to make it hard or easy. And sometimes it's just, you just get surprised. And we're pretty good. We're pretty timely. We're usually on schedule and as close as you can be for something where you don't know what's going to happen. Today, they were bigger than they looked. They looked easy, looked simple.
Got it.
And just weren't. And took longer. And doing the Mohs, we checked the margins each time. We cut out a little bit, check on the microscope, and then come back. And if it's clear, we close you up. If it's not clear, we keep going back and forth with a little kind of a grid mapping system, and do that until we're clear. Usually the average is one or two stages. And today one took 4, one took 3, higher than average. Usually it's 1 or 2, and you're pretty good.
And they're awake the whole time, right?
Yes, yeah.
Just
That's kind of
local.
the benefit of that. Is it's just local numbing medicine. Yeah, no sedation, not hospital.
Right.
Some derms that either academic or they do major cases, I guess you'd say, that require a little more than just local. You can do. It's pretty impressive what you can do with just local. I have I don't know if I can say it, but on our social media stuff. There's pictures of what you can do awake. It's pretty amazing. But some things even though it can be done awake, if you're kind of considering patient comfort or if it's not the best for them, I'll say this can be done here, but I don't think we really want to do that. Like, let's get you to somebody that can close it up, give you a little either light sedation or if it's needed, full sedation, just for them. Because it's not to make me happy. I don't have to have a trophy. I just say, if you're happy doing it one way or the other, I'll get it worked out for you.
I had thought about one of the benefits of a video podcast, right, is that, and if people have checked out our prior episodes, I can bring up, another machine, and I'll bring up the internet. I'll bring up, and I have some stuff saved for you later. But I had a thought for like 2 seconds of, I could bring up some skin cancer images, and then you start looking at some of them, like, I don't know if that's a good idea.
Yeah. To me, it's I don't think about it, but I sometimes we'll get on this conversation. I want to show something. I forget that not everybody. It's not dinner talk for everybody.
Right.
For my wife's in dermatology also. She's a physician assistant.
Okay.
So we'll have these conversations at dinner or something come up, and that's not normal for most people, and I forget that.
Well, and in doing the research for this episode, it's one thing to watch the news and they're going to say, okay, a warning, we're about to show some graphic images. Could it be from war? It could be from whatever, a shooting or something. And in this case, it was a girl. I guess something went viral with her. She had a tanning bed. She got skin cancer from going to the tanning bed, and her image went viral. And you probably know which one it is.
Yeah.
But I saw the clip where the news was saying, we're about to show you some very disturbing images. Yeah. And then you see her face, and for me, I'm fine.
Yeah.
I'm not going to be grossed out or traumatized by seeing that. But then you can also say, well, there's other people who don't want to see that.
Yeah.
But I don't think I had ever really thought about that. Just the way he presented it, like, what are we about to see?
Yeah. That one was actually that showed me the whole social media, and that was kind of early on the social media days of stuff. It's amazing how stuff like that takes off. That's the only experience I've ever had with that. We do social media. It's not like it's my thing. Some people push it. And, that went out like I think one night, and then I heard about it, and then that morning, I think it was Good Morning America called the office. And they said, we want to do an interview. Can you be ready by noon? I was doing surgeries. I hadn't shaved that day. And I said, well, I guess. And I didn't know what they wanted to ask.
What year was this, by the way?
Oh, that must have been 2000. It had to have been either, because we opened in 12 here. It's probably 13, 14.
Okay.
So it was early on, I think, as far as I remember it was.
So when they say come on, this isn't a Zoom.
Yeah.
They're sending a crew over to interview you.
Yeah. And I was not ready for that, because that's not my thing to do TV interviews and all that kind of stuff. And they had the lights set up, and again, I didn't really know which angle they were going to take on this thing. I was kind of a little bit blindsided by it. And the images, we see those all the time, every day today. I mean, I see them every day. That's what happens with that medicine. But the world hadn't seen that.
Right.
And somebody decided, we're going to put it out there and show you what it is. And I didn't get into it a whole lot, but I went on there and saw a couple of posts. I said, what's this thing? Why is it taking off so much? And reading the comments. And people that didn't know me, didn't know the story, some medical people bashing me. I would never let that doctor should be reprimanded by the state and this and that. And they didn't know, I'd explained it. And yes, it was severe, but I didn't hold them down and make them do that. And it's a lot more to it, so you kind of appreciate.
So it was your patient?
Yeah.
Okay.
Yeah.
It wasn't clear on the clip.
Yeah. You and I can say that. Normally we can't, but since they, that was public knowledge at the time, it kind of makes you appreciate how either way it goes, the social media stuff, if it starts going on take on life of its own, you can't stop it. And if somebody gets that momentum rolling of, hey, this is the doctor's fault, or he did something wrong, that can, and it didn't all take that angle, but I tried to kind of somewhat correct it and say, for educational purposes, like, hey, this is, a pretty significant but normal, you're on the high end of normal, but you are normal reaction.
Right.
Hopefully, again, I don't know where that wound up trickling off to, but I'm hoping people kind of realize that educational-wise, instead of, oh, this bad doctor did something wrong.
Yeah.
Which is crazy that people don't know you just jump on the bandwagon.
I'm sure while that was happening, you were thinking to yourself, how did I get into this?
Yeah.
This is just normal course of business, right? Like you said, with social media amplifies it.
Yeah. And
the next thing you know, you're in this situation like, how the heck did I get out of this?
Yeah.
Right? This is ridiculous.
And what I remember, I was fairly early in the practice, I think. And I didn't dwell on it, but it's one of those things about, wow, how is this going to affect, is is it going to be the educational side, or is it going to be this doctor is the guy that messed up, and then blame me?
Yeah.
So I was like, man, I'm going to take a hit here. But thankfully, it just kind of wound up being social media. It just was there for a week, and then it was gone.
This is this isn't a story that relates to that in any way from a medical standpoint. But if you catch up episode 11 when Tori interviewed me, I talk a lot about what I used to do for high school sports, right?
Yeah.
And there was this game I did, and I was using 4 cameras to do this game, but I don't record on the cameras. Just like now, everything gets recorded in the laptop.
Yeah.
So I can switch between everything, but I don't. It's not like I have the recording of just you sitting there or just me. Actually, I'm gonna switch over. But that's just the way I did it. So I had a 50-yard line camera, and then I had an end zone camera, and then I had 2 sideline cameras. Okay. And there was a very questionable late hit that happened in the fourth quarter, and it was between rival high schools, and kid gets put on a stretcher.
Oh wow!
Put in the ambulance, and I didn't. It's unfortunate. It took about 45 minutes, right, for them to attend to him and get him off the field and everything. And then it was like late in the game, and it was just a terrible situation. And then by the next day, I start getting phone calls. Hey, do you have the footage of this hit?
Yeah.
Do you have the some other angle? Mm-hmm. And I hadn't, because the game was so lopsided. I had already starting shut down a lot of my equipment in the fourth quarter, and we just kind of went to our 50-yard line camera. So we had the same view as everybody else. And then I got another call. Hey, do you have any angles of that hit? I mean, I all of a sudden entered a very uncomfortable territory.
Yeah.
Where you're going from just kind of a hobby, you're trying to provide a service to a high school, to people want to press charges.
Yeah. And
I, in a way, am very thankful. I'm thankful in a way I didn't have the footage, but at the same time, if I had it, then who knows what would have happened, right?
Yeah.
Like that would have been very interesting how that all went down.
Yeah, yeah. Sticking to day-to-day routine is, and then, coming back to the kind of picking your profession thing, that's what I liked about Derm. It's fairly predictable.
Yeah.
Go off your normal routine, sometimes it throws you off a little bit.
So, okay, let's go back to when you finish up. You're now a bona fide Dr. Bo Rivera, and you just come to Huntsville. Mm-hmm. So, in the Southeastern skin is where you can't, like, where are you working now, and is that your practice?
Yes. I finished so after dermatology residency, I did a Mohs fellowship in Des Moines, Iowa, and then after that, immediately came to Huntsville, Madison, and opened the practice. So it was Southeastern skin cancer and dermatology.
Okay.
Opened 2012. So we're coming up in August on 10 years.
Nice.
And just thankfully, this great patients around here, this area supported us. We've hopefully done a good job, and that's hopefully why they keep coming back.
Who's the we?
Just the staff, the team. It's not just me. I mean,
right.
I do my part, but I can't do it on my own. So it's the medical staff, the front desk reception, the billers, the scheduling. Everybody has to do. We kind of all buy into this. Good or bad, medicine's turned a little bit into almost a service industry. People expect a little more, and that's kind of our discussion is we want to be more than just what you'd expect from a doctor's office. We haven't done it because of COVID. I need to get back on my routine, but previously we'd brought in good examples of leadership and service. We brought in Chick-fil-A managers, Publix managers, different things like that, to just say, here's what they do outside of medicine. Let's pull that over into medicine and try to make it, take care of their medical issues, but make it as enjoyable and pleasant as possible, so that they, in worst case, they don't mind coming there, and maybe they might even somewhat enjoy it.
But are you the only doctor?
I was the only doctor for quite a while, and then we added Dr. Zimmer a couple of years ago.
Okay.
It took a while to find her, because this area it was growing, and it was still an impressive area, but didn't have the national name, I guess.
Yeah, the notoriety.
So it was hard to get
it
people
does now.
It does, it does now for sure, yeah. It's amazing. So, it took a while to even find anybody that would entertain talking to us, because we're like, well, you're in Alabama, I don't know about that, and I'd say, well, this is different, come look, listen to our little pitch and maybe see the town. Couldn't get anybody really bite. And then Dr. Zimmer thankfully did. Been great. She's been here a couple of years. Since then, the notoriety of the town's taken off, and of course, we're having more interest. And at least people, if we contact them first, or if they contact us, there's a little interest to begin with. Instead of having to try to sell them on it, they're like, okay, you're a viable option to begin with. Now let's talk about the practice and all that stuff. So it's been great. I mean, it's again the local area support us, and it's an easy sell to a doctor, a physician coming in, because to brag on the patients and the population around here is easy. It's just they're great. And it's not just, I mean, the engineers are great, the military are great, but even the locals are great, just the country Alabama people, but everybody in between is just, as a group, this area is just so easy to treat. Just good people, and they listen. They want to do good, and they want to get better. And when we talk to them and give them a plan, they want to partner up, and it's nice to have that.
Are there not enough dermatologists in the area?
No, there's not enough anywhere, really. New York is pretty saturated. Miami, some of the bigger cities are a little saturated, or a lot saturated. Really, but beyond that, most of the country is just, there's not enough of us. There's a cap. There's a certain number of dermatologists that are trained every year.
Got it.
A lot of government budgets and stuff like that. So
you and any other dermatologists in the community are doing what you can to keep up with the demand.
Yeah, and that's what's hard, because we want to keep up, and I hate having long wait times to get somebody in if they want to schedule and it's X number of months out. But I mean, we're working, and it's just you can only do so much. And I had somebody at one point tell me to be concerned about it and try your best to meet the demand, but don't feel personally guilty about it, because what would they have had if you hadn't come here?
Right.
And so I kind of try to remember that. I said, I'm not caught up, and we're growing the practice to meet the demand. I don't really have a goal of, here's the goal of whatever. It's just, let's keep growing if we can, to satisfy as much need as we can to get everybody happy.
Yeah.
And we're always going to be behind the curve until it's going to take a while to catch up, because we start catching up, Huntsville grows, Madison grows. Catch up a little bit, Huntsville grows, Madison grows. And I'm hoping eventually we can at least make a big dent in it. It's hard. There's just not much of us, not many of us.
Let's talk about skin cancer for a little bit. And I guess my question is, because it's on the surface, right? You can see it. But how often does it also just go misdiagnosed or not noticed? I mean, how obvious, I guess, is skin cancer? Can you talk about that a little bit?
Yeah, I guess it depends on which type. A lot of people think they hear melanoma. That's the big one. They hear melanoma. The big three are basal cell, that's the most common, squamous cell, and then melanoma. Right. So even if you've heard of all three of those, they kind of think, well, that's maybe it. But there's multiple, just tons and a lot of them are rare that I'll see once in my career ever. So it kind of depends on which ones you're talking about. In the basal cells, usually you kind of know what you're looking for. You can spot them before they get too big. And squamous, kind of the same thing. The melanoma is the one that's going to, if you let it go, it can hurt you the fastest. And that one's scary, because sometimes it's really obvious. Everybody hears about the big black mole that looks bad and bleeds and all that. That's the easy one, because patients even notice that one. There are some that are more pink, or what we call amelanotic, which is skin color. And a lot of people don't know. They say, well, there's no color. I don't see it. And that's the scary one for us. It's the hard part. We look and we try our best, and they melanotics are the ones that don't have color. Something sometimes is a giveaway. It's either bleeding, hurting, itching. If it's the point they don't really have symptoms, and then eventually it does, how long has it been there? And sometimes we don't know. It's either it's the first time seeing us, the patient's first time seeing us, or we've been watching for a while and it's skin colored.
Can you see it with your naked eye, or do you have to use?
Even sometimes with we have what we call dermatoscope. The amelanotic, so normal melanomas, yes, we can see them and either monitor if we're suspicious or take a biopsy or whatever. The ones that bother us are the ones that grow that we don't realize are there. That's our job. We're supposed to be catching it. And then eventually it's caught, whether it's early or late. And those are the ones that keep you up at night, I guess. You have somebody that gets diagnosed with it, and you're like, well, did that suddenly grow from 6 months ago? Yes, it could have. It's skin colored, and it may have been totally new, or has it been there? And we just didn't see it because it's flesh colored. It's no symptoms until it started bothering them. Those you always kind of wonder, what could I have done differently? Is this cancer advanced enough that it's going to hurt them?
Right.
Ideally the goal is that hopefully we're trained enough that even if it's even if it's not noticeable at first, hopefully we catch it early enough that it's not a danger, or at least limit the danger. But sometimes it's just hard.
Are people? I mean, they're not going to. They're going to their internal medicine doctor first, right? Maybe they discover something on their own and they inquire. But how often do they go just unnoticed for a prolonged period of time before somebody notices? Whether it's them or they go to a physical and doctor, maybe the internist doesn't notice it, and you know what I mean? Like, is it too much of a high percentage where it was, man, this was discovered way too late before it became, your responsibility to take care? Yeah,
not usually, at least for melanoma. So again, it's kind of each cancer, you have to almost have your own discussion. But melanoma, thankfully, most of the time, we know what we're looking for. And even the subtle ones, we catch it early enough that it's pretty treatable.
Okay.
There's some that, and again, they keep me, I'm thinking of people right now in my head. I mean, like it sticks in your head. When it happens, it's just hard. It's going to happen, and you wish you could. There's nothing else different you could have done, but occasionally you get the one that when they come in, you biopsy it. That the first time you see it, the first time you found it, nothing you could have done differently before. That's just it. One of the really extreme examples was, this was not to say a subtle one, but a guy had come here for I think family or vacation or something like that from out of state. I'm gonna try to be careful not to tell too many details here. Gotta be careful about. Something had come up. He said he'd never been there. Per his report, never been there. Got in with us just for the 2 weeks he was here. Biopsied it, and it was by paperwork, by the report, it was one of the worst ones I'd ever seen. It's really aggressive, fast growing. So, could it have grown up in 2 weeks? It's possible, the way as aggressive as it looked. He went home, and I checked up with a dermatologist. I passed that on to them going back home. It was 2 to 4 weeks later, and he had passed away. It spread from nothing to so those are the ones that bother you, because you're kind of, if I had could I've done anything different? Would I've? But thankfully, most of dermatology is happy. I mean, I'm probably dwelling on that part too much. Most of everything we find it early. We know what we're looking for. And it's a happy story. Yeah. Basals are, as long as they don't get left, you treat those and you're good. Squamous cells, as long as you don't leave those, you're good. So usually the routine dermatology is you come in, get your screening. There's either nothing there, or the next time we see you, there's something there. We biopsy it, get treated within weeks to month, something like that. Yeah. And it's good. So that's another thing about dermatology that's good, is that most things are positive. Yeah. But the few that aren't, sure, they always bother you. Again, like I said, I have a list on my mind. I'm seeing these people right now that, sure, it's, you want to be perfect. You want to, but
let's switch gears. Yeah. One thing that you mentioned to me in just a little bit of Q&A, right, as we prepared for you to come on the program, you said you met your wife on an airplane. Yeah. Please share with me the context of that, where you were going, where she was going. Yeah, that's awesome.
Yeah, that's a pretty fun one. That's so it was in 2012. 2012. I was finishing my fellowship in Iowa, and there was a dermatology conference in San Diego, and we had both gone to it. Didn't meet each other there. Didn't see each other or anything. I had my flight went from San Diego to Denver, and then Denver to Des Moines. Hers was San Diego to Denver, and Denver to Orlando. That's where she grew up and practiced she's a PA, dermatology PA practicing down there. Assigned seats, so it wasn't Southwest, right? I kind of found the cute girl.
I'm sitting next to her.
Yeah. It's like I walked in the aisle and found her. There's a debate between us of who was seated first and who saw the other person, but either way, sat down.
Wait, were you in the aisle?
I think I was by the window, and she was in the middle seat, I think. Okay. There may have been 2 seats. If there was 2 seats, we were same thing, window and to my left.
You always got to question those middle seat people. Like,
yeah.
What's going on with you that you can't get a window or aisle?
Yeah,
right?
Yeah. And I can't remember who initiated it. I'm not good about doing that, especially if it's a cute girl. Mm-hmm. So and she's pretty social. I'm kind of the laid back one. She's the social one. somehow started talking, and thankfully from the start we had the dermatology. Excuse me.
Mm-hmm.
The dermatology thing in common. So that helped kind of break the ice, and we got to talk about the conference and whatever else, and just chit chat.
Yeah.
It was an hour flight, hour and a half, something like that. And so the whole time I was like, hey, this girl's all right.
Yeah.
But she's in Orlando. I'm in Des Moines. You know, who knows where I'll wind up after this. Maybe I'll be in Alabama. Maybe I'll go somewhere else. But I was thinking as we were taxiing back to the gate, I was like, well, you know, I wouldn't mind keeping this going to see what happens.
Yeah.
But I didn't want to mess it up. I didn't want to make this great conversation just flop right at the end. So I was trying to run through these different ideas of how can I pull this off, just be smooth about it and let it work out. And she saved me. She looked over and said, do you happen to have a business card? And she claims that she was just keeping her business connections open.
Yeah,
so
sure.
she said.
Sure.
And I didn't have a card. So I said, no, I don't, but I can give you my number, swap numbers if you want to. She's like, oh, yeah, that'd be good. Swap numbers. I knew that she was pushing it to make the air flight. I think we had a delay a little bit or something. She was a little bit late. So as I was going to mine, I texted her right away and just said, hey, hope you make your flight. Enjoy talking to you.
There you go.
And for
Good
some
move.
reason, she said that made an impact because she was used to, at least her stories, I guess, had been, people weren't that direct about being nice about it. They wanted to play it cool and, you know, let's wait 2 weeks before we text back and not seem too interested. And she's like, you were actually just nice.
Yeah.
And I said, well, yeah, thank you. I was just trying to be nice. Stayed in touch, talked, you know, somewhat sporadic but regular. Decided we want to have a date, so we met up in Chicago of all places. I can't remember if I flew or if I took the train, but went up to Chicago. She flew from Orlando to Chicago to meet this guy that she's seen one time on a plane. Of course, all her friends thought she was crazy. Date
A
went
guy
well.
named Bo.
Yeah, he's a guy named Bo. That's all I know. So that went well. Had a second date a little bit later, a few months later in Nashville. And then let's skip all the details in between. But either way, eventually came down to where I decided at that time I was going to practice in Alabama. And I said, you know, I can come to Orlando or not. And she's like, well, I'm not sure once you move in here yet. Didn't want to commit that much. I said, okay, I'll be in Alabama. And I said, if you want to make this work, I'm in Alabama. And again, a little bit after that, it wound up officially dating, I guess. Yeah. And it worked out.
And what year did you get married?
Oh, that was 14.
Okay.
Yeah. Actually, this tying back to Mark in Haleyville again, kind of that whole story, kind of to wrap that back around. The first official time we were dating was the Mark Forster walk.
She walked it?
And she walked the end of it. Yeah, they were actually impressed. So she didn't walk the whole thing. But she asked, I'd been talking about it. I was walking some, getting ready for this race. And I think that was it must have been 2012. And just out of the blue one day, she said, hey, can I go that race? Or not race, but go the walk. I said, well, you can. It's in my hometown. And she wasn't officially dating me at that time. Mm-hmm. I said, you can. I'm going to be staying with my parents. Do you want me to get you somewhere to stay? Or, who do I tell them? Let me just let them introduce you as my friend or what's...
Right.
And she's like, no, that's okay. I can meet your parents. I said, well, are we dating or what I tell them? She goes, yeah, I guess so.
There you go.
That was our official dramatic. It wasn't an emphatic yes. It was just like, yeah, I guess so.
That meet the parents moment.
Yeah, it just kind of happened casually. But yeah, the last leg of the walk, we stopped at Mark's house, the Forster's house, and then walked back to the school. I can't remember the distance that is, but she decided to jump in. She didn't walk the start of the walk, but that part, she wanted to walk that segment. She had flip-flops on, of all things.
Wow, yeah.
And walked it in her flip-flops for a few miles. And
so that must have been like, the 33 miles they were doing back then?
Yeah, I can't remember what the mileage on that one was, but yeah, it was more than the 28 now. Yeah, we were getting up pretty good. I can't remember the highest that we went, but it was getting up high.
I think you said, how many times did you do it?
Oh, I think I've done it maybe 4, maybe 5, like 4 or 5, something like that.
I just did this last one.
Yeah.
And that was brutal.
Yeah.
I was not prepared for that.
Yeah. It's different. Even if you're in shape, it's a different.
Yeah. Just the beat up my feet.
Yeah.
I didn't have the right socks. I didn't have the right shoes.
Yeah.
Lesson learned.
Yeah.
But at the same time, I mean, I was blistered up and hurting after 8 miles.
Yeah.
So I kind of felt like, and every time you stop, same thing when you run, right? They call that pickups, right? It's always hard to like stop and then try to pick up and resume, rather than just going. It was like incredibly difficult to like restart.
Yeah.
And you know, you can feel your blisters, but I was like, you know, I just soldiered through for 20 miles.
Yeah.
Just blister city.
Yeah, yeah.
And got through it.
I never liked stopping. They take the breaks, which we need to, but
Yeah.
I never liked it. I said, just get it over with. Let's go as quick as I can because I want to keep moving.
Well, you got to do it next year then.
Yeah. I haven't done it. They haven't had it in person in Haleyville last couple of years, COVID and all that.
Yeah.
So yeah, I'm kind of ready to get back because that was fun. That was fun to have all the people there, and it's a good group of people that come back and do
I'll tell you, if you're ever, the great thing about a walk like that is it's a great team building thing.
Yeah.
So I show up, I only know Thad,
Mm-hmm.
but then there's people like Chris from Tuscaloosa.
Yep.
That was good friends with the family, and then just others, right?
Mm-hmm.
That were, one was from the same unit.
Yeah.
What's his name? Starts with an S. Sasha.
Mm-hmm.
Sasha was there, and just other people. But in the course of 28 miles, you're gonna have that kind of one-on-one with every person you didn't know when you first showed up. So then you kind of build that, whether it's brotherhood or sisterhood.
Yeah.
You build a bond, and you share and swap stories, and then by the end, you're like this unit and like this team, right? And you've all pulled for each other.
Yeah.
And I just thought, man, we don't have to do 28 miles, but the next time I want to do like a team building thing, like with work or church or anything, that would be a great idea.
Yeah.
Where you want to bring people together and force them to interact over the course of 5 to 10 miles.
Yeah.
Right. Where they just have to walk and they just have to talk.
Yeah.
And it will just happen naturally.
Yeah. And it's fun because a lot of the same people, it's always new people being added or people swapping in, swapping out, but it's fun. You get to see some of the ones you hadn't seen since last year, and you just can't keep up with them.
Man, Thad's a trooper. He had no blisters.
Yeah.
He showed me pictures of prior years where his feet were torn up, but he finally has come across like the best shoe and the socks, and I was just like jealous. He was walking backwards, and I mean, we were just I was dragging myself to the end.
Yeah. Knock on wood. I've been really fortunate. I had 1 year that my knee gave me some trouble, but no blisters, it gets hot, but I've little hot spots, but I've been able to thankfully dodge it a little bit.
Yeah. Tell me about the rest of your family.
So most of my immediate family is still in Haleyville. My parents live there, my sister, her husband, family, and then they still live on the same street. So my parents still across in the Foresters. My sister took over my grandparents' house when they passed away. After my uncle had it. So she's still on that same road. So it's kind of interesting that most of the road, not all of it, most of the road's still kind of the same old people there. My family here in Madison, it's my wife I was talking about, have a couple of kids, young boy, young girl, still kind of having the effort of that. They're great kids, but of course the effort you put into little kids is they come home and it's full bore. You come in the door and you're tired, but they're ready to play and everything else.
They don't care what you did at work that day.
Yeah. So it's kind of the quick routine we get home. We do the play in, get the dinner ready, after dinner, books, all that kind of stuff.
Any pets?
We have a crazy Labradoodle.
Okay.
She has some anxiety issues, but she's a. It depends on what day you ask me. She's a sweet dog, but she's got her own little issues. She was, golly, I went to the store with a patient the other day asking me about. We're talking about dogs for some reason. She was actually got to the point of being medicated by the vet for anxiety.
Really?
It turned out it didn't really help. It kind of was maybe even made her even more skittish. But yeah, she has these episodes where she just gets scared of anything. Scared of grass, scared of frogs, scared of
How long? And how old was she? Is it she?
She, yeah.
How old was she when you got her?
We got her right from the breeder.
Okay, so it wasn't like a bad experience with the prior owner or anything. It's just
No.
the way she is.
Yeah, and the breeders were good. They were low volume.
Yeah.
They took care of them. They had this, pretty much a farm that was dedicated to taking care of puppies, and they had horses and stuff too. But I think it's just a personality thing. And we're trying to figure out what it is.
Yeah.
Because for her, it's not as fun. I mean, we deal with it, but she can't fully relax. It doesn't seem like all the time. She'll be relaxed, and the next minute she won't be. And So the patient was recommending CBD for dogs. So I don't know how that,
I don't
know what
works.
the options are out there, but
Wow.
their non-vet professional opinion was try that. So that might be our next thing. I don't know.
You're like, I hadn't thought about that.
Yeah. So, but she's overall okay. It's just that some days she's a little high strung.
I tell you what, let's play the quick six.
Okay.
I like to do this because sometimes your answers will generate some additional discussion afterwards.
Okay.
But I also want to make sure we have enough time for it.
Yeah.
And I actually might do 2 games today, but we're going to do the quick six.
Okay.
This is the game where you don't have to be quick on your answers. It's just called the quick six because it sounds cool.
Okay.
So some of them are short and may necessitate a short answer, but otherwise you don't have to be quick on your answer.
Okay. I feel like I'm walking into my test here.
Yeah.
Getting the nerves for the test.
All right. So cruise or all-inclusive resort? You said you went to Bora Bora on your honeymoon.
Yes.
But so I don't know. When I think cruise in my mind, I always think of like the Caribbean, you know, and tropical stuff.
Yeah.
There's tons of genres of cruises, but
yeah, that's kind of what popped in my mind right when you said that. It's probably gonna be biased just because it clicked to my experiences. I mean, I've loved the cruise. I've done a couple cruises when I was younger, and they were great. They were fun. Unlimited food, unlimited whatever else. But Bora Bora is what popped to my head. And it's probably just because I was thinking about it the other day. But
and that was an all-inclusive?
Yeah, that would be it. It's so fun being on a cruise, but that was just amazing. It was and partly it may have been what they had, all the little massage and all that stuff, but it's just so relaxing. I think that was probably why I like it better because I don't need all the social rah-rah excitement. And a cruise gives you all that.
Sure.
But you are around a lot of people all the time. And I think the all-inclusive where we went was a little more, I would say isolated, but it was not as dense a population. It was just nice to be unplugged from people and from stuff.
Yeah.
And to have that, it was more relaxing to me.
Okay.
And I think that's more my style. I don't need the Vegas lights or anything like that.
Yeah. Yeah. And sometimes on a cruise, if there's too many, it just can be too much logistics or you don't really have enough time.
Yeah.
Where it might just be just chill in an all-inclusive resort, right? And
Yeah.
you don't have to get up and you have to go do this or have to go do that.
Yeah, I enjoy those. We actually were scheduled for a Disney cruise.
Oh, yeah?
3 months, with March, I think it was. It was right after COVID hit. So that one kind of
Postponed it?
Yeah. We haven't. Yeah, I don't know postponed it for how long, but yeah, it's supposed to be a extended family. It's supposed to be us, my parents,
Gotcha.
the whole crew.
Yeah.
But so we'll see if that gets rescheduled or not.
All right. I know you. I want to talk about this when we're done with the quick six, but I know you work out. You get up at 4:15 in the morning, and you stay active.
Mm-hmm.
Give me one goal you have physically, whether that's a marathon, an ultra, a trail run. Like, what do you? In part, it's like what keeps you going. But is there something you're training for, or you would still like to do?
Yeah. I've done half marathons. Before. I'm more of a sprint type guy, but I can train up and be an okay distance. So I'm kind of okay at everything. I'm not necessarily a star at anything, but I'm okay at everything. Possibly marathon, maybe. It's just that right now it's hard with the time commitment to do that. A generic answer is just that I want to stay in shape, just stay fit. I always want to be able to move and do things. The last couple of years I've seen I think it was both years. I know this year it was the pin relays. Last year, maybe in pin relays or something else, but seeing the upper age sprint event, 90-plus-year-old guys, that's a long term that if I can keep it going, which I need to get back more into my run. I do workouts and it's some movement, but it's not necessarily a run. I need to get that going a little more. But if I can keep it going, I don't have to win it.
Yeah.
I just want to say that. I don't care. Just start the start line, end at the finish line. To do that when my goal is 100.
Yeah,
if I could do it at 90, that would just be, it'd be so fun.
That's awesome. Last book you read?
Oh man, let's see, what would that be? Lately I've been on this kick of financial, real estate type books, which really, truthful, last book is probably medical. That's probably, but as far as non-medical stuff.
Right.
Our practice, we're building a new building. It's going to be finished in a couple months.
Okay.
Just right half a mile from where our current one is. So what started that was trying to find land that was close to our building that we could build on. I couldn't find a small enough parcel. So I was like, what am I going to do? I started looking around. Just by dumb luck and somewhat trying to educate myself, I found a parcel that was larger than we needed, and then went the whole process of learning how to get the engineers and the architects and the right people, subdividing it, platting it out, doing all that kind of stuff, and getting rid of those parcels, and then keeping my parcel that I needed. So kind of start with that size, and then divvy up everything else.
Leasing out the other spaces.
Yeah.
Nice.
Well, I sold them, but yeah.
Okay.
But that whole process to me was a lot more fun than I expected. It's just the whole workings of how, and maybe it's because something different, and I enjoyed learning. So I got on this kick of learning what all you can do with that, how it works. Do I want to eventually throw it in one day as a side hobby when the kids are a little older and I have more time? Do I want to? I don't know. It's just really fun. And to me, every time I read one of those books, because I've never done that, every book I'm learning a lot. And it's been a while since I've really had it's fun reading fun things, but that was a learning thing. I felt like I was back in school, and that feel is fun, just to be learning.
It's fun to learn.
Yeah.
I kind of miss that about being in school.
Yeah.
Just the whatever it's some of it's just what's going on current events wise that might impact what you're learning there, but just kind of being a group of students and everyone's kind of just soaking it up and trying to improve themselves. Yeah.
And even beside that, it wasn't necessarily a book, so a little bit off topic, but the process of building a building, because we're building a house also, kind of everything. It was supposed to be offset by a few years, but between COVID and everything else,
right.
Both projects are kind of paralleling each other right now.
Right.
So learning the terminology and the details of architecture, even though I didn't really know anything. I started off in it, but I don't know any architecture. I joke with them, but I don't know anything. But learning that aspect and what to do, the engineering side, all the sub-engineering, geotech versus civil versus these different things, lighting engineers. I'm probably driving them crazy, because instead of just giving them an answer or telling them what I want and moving on, I want them to teach me, and I'm probably asking too many questions. If they listen to this thing, they're probably gonna
like that guy.
They're probably gonna give the thumbs up. That's exactly what they feel. But I'm probably driving them crazy with just excessive questions.
Well, it's like you said when you went to Auburn and you were in engineering and you bailed out of it, but you also didn't really necessarily explore all of the sub specialties, like you were saying, mechanical, electrical, whatever. Right?
Yeah.
There's so many different elements, civil, to that.
Yeah.
So give me something that you would. If there was one piece of advice that you could have given to your 12-year-old self, with everything you've learned, and you have the benefit of retrospect and experience and education and knowledge, pull aside little Bo and Haleyville.
Oh my goodness, this is it. Yeah, and I don't know if this will be necessarily something that was at first when you started going that way, I was trying to think of what could I tell myself to do differently. But I don't have too many regrets. I don't feel like, even the little stuff, I feel like everything happened for a reason. It got me where I am. So I think the big theme is a little bit kind of, we started from the start, is that, and it probably comes from being supported. You have people that don't tell you no and don't shoot down your ideas. Just is kind of that. It's just, if you want to do it, do it. If you don't make it, you're going to still learn something. It's probably going to put you closer to something else that you need to be learning, or get you that next step, wherever that next step takes you. The next step takes you the next step. Yeah. It's just to keep pushing. If you want to get it, do it. I like that. I don't mind people being honest, or me telling somebody my opinion about something, about, hey, this is going to be hard. You're going to have to. Yeah. I don't want to tell them not to do it. And I hopefully most of the time I try to encourage them to do it. Realistic's okay, but doesn't mean you can't push it.
I don't know if you know who Jocko Willink is. He was in SEAL Team 2 and does a big podcast. Big dude. He has a book called Extreme Ownership, and I was just listening to an episode today. So one of the things I do to like my last preparation before I have a guest, I'll usually go on a 4 or 5 mile run at some point during the day. And I was listening to his podcast and he was interviewing a former Navy SEAL, and he was saying that his grandpa would tell him, he wouldn't say, "Hey, what do you want to do when you grow up?" He would say, "Who do you want to become when you grow up?"
Nice.
And yeah, and a lot of times I'll listen to podcasts just for like kind of motivation for like that. Like, okay, can I be a better father now?
Yeah.
When I talk to my kids, and maybe use more of that and just really try to inject in them like, hey, yeah, go after it. There's nothing that, can hold you back, right?
Yeah, yeah.
If you dream big, whatever. But I thought that was cool. Who do you want to become?
Yeah. You always wonder that about kids too. You want to do, am I doing the right thing?
Yeah.
But it makes you think a little bit, and I mess up. I'm sure everybody does, but you mess up.
Yeah.
And you just gotta kind of hopefully get yourself and them back where you want to be, and hopefully give them some pointers along the way.
All right, question 5.
Yeah.
So no matter what, you're getting a Ferrari. You're getting the latest and greatest. Someone's giving this to you.
Is this part of the show? Is this like a post show thing?
I don't know. No. yeah. It'll be waiting outside with like 3 wheels on it.
Yeah.
No, but so someone's going to gift this to you.
Okay.
And the finest interior, right? The fastest. This is the top of the line Ferrari.
Okay.
You get to choose one thing, the color. What color do you want that Ferrari to be?
I was about to give you an or answer. I guess I can't give an or. I'd probably say black.
Black.
Yeah.
Okay.
Yeah.
Good choice.
I think the dark ones. I like the go. I don't like the. No, say I don't like it. It's not me at least. The flashy neon green or anything like that.
Those people probably have enough money where they actually have the black one in their garage.
Yeah.
And they happen to have a neon, but yeah, I'm with you.
Yeah, I keep it simple. I drove one probably 3 or 4 years ago. It's that I think Stephanie got for me. I think my wife got for me. It was a tour. They go around different cities and they set up a track. This one they set here in Huntsville at Joe Davis Stadium in the parking lot.
Oh, really?
And you pay X amount. I can't remember. It wasn't that much. And you get to drive a few laps of either a Ferrari, a Lamborghini, or something else. It was fun.
You drove the Ferrari?
I'll never have one, but it was fun.
How fast did you get it up to?
Probably they had the course mapped out to where you.
It was more just the power.
I think I got up to 60 or 70.
Okay.
Just in a short spurt straight away.
Yeah.
It's hard to explain it that you push the gas in most cars and it will get there and it'll go fast.
Yeah.
It was amazing to push it and it was already fast before you. It's almost like it knew you were going to go fast and you pushed it. It was already there.
Predicted it.
Yeah.
All right. What do you want on your tombstone, or otherwise, how do you want to be remembered?
Oh wow!
You're
getting smart. This one I should have had.
Yeah, it'd be
that.
easy if I was sitting over there. I'd be. I don't know. It would take me 5 minutes to answer.
Yeah, I don't want to give them those just the cheesy, the ones you always hear all the time. You lived a good life, and that I was happy.
Okay.
I think maybe that wrap. I was trying to think of something that would wrap up everything.
He was happy.
Yeah, I think that's probably it because and part of it's a choice in doing things, but I think that's probably the best way to summarize it, I guess.
I picked up on something earlier. You said you were talking about the peak. This guy at medical school, and he said, and the way you said it was the peak of depression, which is an optimistic way or a very positive way of saying someone who's at the lowest depth of rock bottom.
Yeah.
So I like that.
Yeah.
Rather than painting the picture of rock bottom, you painted a different picture of peak.
Yeah.
Which you would attribute to height or something, right? At the peak of a depression. Like, okay.
Yeah. And maybe
it's a positive guy.
Yeah. It's probably family too. I mean, it's probably genetic, I'm sure, but family too. My dad's super optimistic all the time. And I think I've tried to always, I guess like everybody else, you find somebody that you admire what they've done or the work it took them to get there. And whether they know it or not, I'm watching them and I see what they've done and I see like, oh, this guy's, he's putting extra work. And the few of those people, whether they know it or not, I stay in touch with them or at least kind of somewhat check in with them because I like knowing what's the latest and what's going on and seeing that they're still doing it. They're still grinding. They're still getting every day. I say every day, but every time I check, you can tell that they're still pushing to be better.
You think you're going to be able to retire? You think you're going to hit an age or?
I don't know if it'd be a flat, just a cold retirement. I'll probably fade out in the sunset because I enjoy it. I would definitely work less. I mean,
Yeah.
I think I'd like to do, chase some of these other hobbies,
Yeah.
and who knows.
You may have a
learn-
whole nother career you didn't even know that's awaiting around the corner, right?
Yeah. And I'm not jumping, waiting to get out of it or anything like that. But at some point, I'll probably transition a little bit, and as long as I can do it safely and feel like I'm helping, probably stick with it for a while.
Yeah. Bo, it's been a pleasure having you.
Yeah, thank you.
Any final thoughts or shout outs?
I don't guess so. It's been great though. This is I kind of talking beforehand. This is not my normal thing day to day. It's the patient one-on-one, but it's not in an environment like this. But you got a good thing going. This is nice.
But when I was thinking of earlier, when there's at least a clip of you when we were talking about that Good Morning America thing,
Yeah.
and after all that effort, we need to talk to you by noon, and they bring on all the lights. And I literally think your clip was, you got to say 6 words.
It was not much. It was,
and you're like, what? Really? This was my big break,
Yeah.
And again, it's like, I'd love to have people ability to come in and be more than just a little soundbite.
Yeah.
Sorry, pal. We only have 1:15 and we're going to put you in for 2 seconds.
Yeah.
Come on.
Yeah.
This is Dr. Bo Rivera here.
Well, I wasn't the focus anyway. But
Actually,
that was a sideshow.
Before we close up though, give me a couple reasons you love Huntsville. You've been here for 10 years. It's grown. Mm-hmm. It's growing. Give me an idea from your perspective. Why do you love it here?
One of the big things I talked about kind of earlier is just the people. It's a good mix of just the type of personalities that do military, that do engineering, the locals that grew up here that are just the good country Alabama people.
Yeah.
The people is one of the biggest thing. It's just good people. I think they're most of them are nice and considerate, and it's nice that there's a mixture of different people. I mean, they come from wherever, Virginia and California and Alaska, and it's fun to get different inputs, and they all kind of, no matter where they came from, it seems like talking to the patients, everybody kind of buys into this area, what it's about, and they want to give their input or contribution to make it keep that ideal, but their contribution to it. So it seems like everybody likes this area and they want it to be better. So it's the people. And again, same thing kind of, like, I guess, touched about in the office, and you're asking about shout outs. The people make the difference in the office too. So I guess the shout out I need to do, because I tell them at work, but just to give them an extra one here, the business has grown, all that kind of stuff, but the staff we have, it's amazing. The people that I talk about, how I like around here, we get the best of those people, and they make us grow. I mean, that's what.
How many of your staff have been with you since the beginning?
I think we only have now. I think we're down to just one that was in the very beginning. But they've trickled. Most of the ones they've left, they've been there for a while. Were more of promotion type jobs that were. I mean, some people sometimes they just take their jobs, but most times the ones that were there for longer periods would go to an either different field or something where they actually just wouldn't have a position for them to go up, so they went out to go up.
Okay, gotcha.
But yeah, just the people, I guess, in the area is. And the second thing, I think you could give 2 things. It's nice that this is a city, and they label it the biggest city in Alabama, but it's still the country. I mean, you can go just a few minutes and you're in the country, in the woods. So it's nice that you can get away and feel like you're in just the middle of nowhere, but you've got all the things that, it's not New York, but you've got really all you need here, for at least me. I guess a lot of people agree because they're all moving here.
We just discovered Rainbow Mountain.
Yeah.
On the way on Hughes Road, which I live off county line. So we go down Gillespie all the way down to Hughes, take a left, and that takes you right to like Home Depot, right?
Yep.
And it kind of avoids 72.
Yeah.
And then one day we're like looking for a place to hike, and I knew there's stuff at Montesano and where we did the 28-mile ruck was, over in Hampton Cove, but we go down Hughes and we take a right into this neighborhood, and next thing you know, we're like in very quality Appalachian Mountain hiking.
Yeah.
Like, this is unbelievable.
Yeah.
It's like on the way to Home Depot or Lowe's or whatever, right? Like, wow.
Yeah. It's
Everything
fun
is so close.
in the city and have that.
Yeah. Well, Bo, I was going to say that one thing you could have said to your 12-year-old self, kind of like Back to the Future, like, hey, when you're on that airplane and, you land, make sure you give a business card or make sure you get her number.
That's true.
Don't let her go.
Yeah. Yeah. That'd be good.
Because you're going to marry her.
Yeah. Yeah. There's another story I'll tell you one day about that. Different related, but it's another story, side story, I guess.
Awesome.
Kind of fun.
Well, hey man, I really do appreciate your time.
Yeah,
And,
thank you.
and all the best. It sounds like exciting times building a new house. You know, got a new business or a new location for your business. And I wish you all the best.
Thank you. Thanks for doing this.
Yeah, you're welcome. Have a good one, Bo.
You too. Have a good night.